especially for the first responders who deal with the immediate aftermath. And for the paramedics who responded to last Sunday's devastating crash in Vaughan, it has been a painful week. They, too, have been coping with the deaths of 3 children and a grandparent.
More than half the first responders who attended that fatal collision are off work seeking help for post-traumatic stress disorder.
Good evening. They spend their days and nights helping the rest of us during times of crisis, but it's becoming increasingly apparent no one is around to help them. A growing number of first responders in our region are suffering from post-traumatic stress.
In roughly the last 10 weeks in this country, 13 first responders, including paramedics, police officers, firefighters, dispatchers, and prison staff, took their own lives across this country.
First responder post-traumatic stress disorder, a hot topic that has caused much debate. A positive outcome of the debate is workplace stress has been brought into the public's eye. But even with all of the attention, it seems like there's little help available for first responders. Nature-rx.org, a website dedicated to enjoying the outdoors, has created a parody of a pharmaceutical commercial that's meant to get people outside and enjoy nature. But some of what they had to say speaks some important truths when it comes to workplace stress. Please be forewarned, the humor is a bit dark and may be offensive to some. Let's take a look.
Do you find yourself longing for the apocalypse? I did. I was looking for a reason to live. Hi. Are you feeling tired, irritable, stressed out? Well, you might consider nature.
From the people that brought you Getting Outside comes prescription strength Nature, a non-harmful medication shown to relieve the crippling symptoms of modern life.
Nature's recommended for humans of all ages, and it's great for pets too.
Nature can reduce cynicism, meaninglessness, anal retentiveness, and murderous rage. In clinical studies, Nature is proven to decrease work-induced catatonia.
Caution. Nature may cause you to slow down, quit your job, or seriously consider what the you're doing with your life.
If you are overly cynical, jaded, or emotionally numb, you may need to increase your dose of Nature. Do you have trouble being even mildly uncomfortable? Nature may not be right for you. Side effects may include spontaneous euphoria, taking yourself less seriously, and being in a good mood for no apparent reason.
So ask your doctor if nature is right for you.
Although the parody pokes fun at a very serious issue, the advice could help some with dealing with day-to-day stress. The creators of a new self-help and peer support program called EVVRe Care claim that the leisure activities mentioned in the parody, combined with other stress-relieving activities and avoidance techniques, may hold the key to mitigating acute stress reactions. But before we look at the program, let's first look at some definitions of stress and stress-related illnesses.
Stress is a physical or psychological response to a perceived threat or stressor. The stressor can be environmental, external situations, psychosocial, caused by other people, personality, things related to the way we think or feel, or a combination of all three. What is important here is it is the perception of the individual which determines not only the existence of a stressor, but also the severity of the stressor, meaning what may cause a stress response for one individual may not cause a stress response in another. Post-traumatic stress disorder, PTSD, is a clinical diagnosis that includes a history of exposure to a traumatic event that meets specific stipulations and symptoms from each of 4 system clusters: intrusion, avoidance, negative alterations in cognitions and mood, and alterations in arousal and reactivity. The duration of symptoms must be more than 1 month and not attributable to a substance or co-occurring medical condition. PTSD occurs when an individual excessively suppresses their emotions after a critical incident and avoids preventative strategies. It is a response that is beyond the normal stress response, where signs and symptoms should gradually diminish over time. If not addressed, PTSD can become debilitating and the condition can be permanent or even lead to suicide. Acute stress disorder, ASD, is also a clinical diagnosis characterized by the development of severe anxiety, dissociative, and other symptoms that occur within 1 month after exposure to a critical incident, but not attributable to a substance or co-occurring medical condition. ASD would be considered if 3 of the following dissociative symptoms are experienced during or after a major stress event. numbing, detachment or absence of emotional responsiveness, a reduction in awareness of surroundings, derealization, depersonalization, or dissociative amnesia. Both ASD and PTSD require professional intervention.
It seems that when you review these definitions, what many have been calling PTSD may actually not be. It's interesting to note that according to some experts, less than 5% of first responders will develop long-term PTSD symptomatology. This rate is only slightly higher than the general population average of 3 to 4%. Other organizations like Temaconter claim that 1 in 4 first responders suffer from PTSD. What most will agree on is the persons involved are suffering from stress-related illnesses, which some are now calling occupational stress injury, OSI. This should not minimize the impact, as OSI is serious, and if the stress reactions are not addressed, OSI can progress to ASD or PTSD. According to the creators of the EVVRe Care Program, those stress reactions can be mitigated. Let's see what the EVVRe Care Program has to say.
Why, when several people experience the same event or string of events, will some cope well and others will not? The key could be in each person's core beliefs, values, life experience, social support, and coping strategies. Picture a Jenga game. Jenga, by Hasbro, is a game where multiple rectangular blocks of wood are stacked in threes, with each row perpendicular to the previous one. Game players take turns removing individual blocks from the tower and placing them on top. Each move makes the tower a little bit more unstable until eventually all the blocks come tumbling down. In this visual analogy, each block represents a belief, support, coping strategy, or a component of resilience. If 1 or 2 are removed, the tower may become unstable, but it still stands. If several, or possibly foundational blocks are removed, the tower will become unstable and may collapse. Similarly, if a person does not have a good foundation of core beliefs and social support, or has minimal coping strategies, the less chance they will have in standing in the face of extreme events. The sum of a person's core beliefs, social support, and coping strategies contribute to a person's resilience. The definition of resilience is the ability to recover quickly from illness, change, or misfortune. It can be viewed as a measure of stress coping ability. Basically, if you are resilient, you'll be better prepared to manage your stress and recover quicker from stress reactions. Let's assess your resilience. There are many tools to do this, but most are based on the Connor-Davidson Resilience Scale, also known as the CD-Risc. It is comprised of 25 items, each rated on a 5-point scale from 0 to 4, with higher scores reflecting greater resilience. The raw scale used here is not the validated version, but it can provide a good indication of one's resilience. Can you teach resilience? Can you become more resilient? We believe the EVVRe Care Program can help. The EVVRe Care Program is an innovative program designed to help individuals manage stress. It is designed to help people be better prepared to endure stress events, to help themselves after stress events, and to provide a simple but useful peer support program to better equip people to help each other. The program will also help you determine when professional intervention may be necessary. It is not designed for individuals who have been traumatized by a critical event resulting in a mental disorder. Signs and symptoms that may indicate an individual has been traumatized or may be suffering from a mental disorder as a result of the trauma, thus requiring formal intervention or professional help are: there is perceived, implied, or potential threat of suicide. There is potential for physical harm to the individual or others. Acute onset of change in behavior or functioning, for example, disorientation, impaired memory, or impaired cognitive function. If the person is experiencing any 3 of numbing, detachment, absence of emotional responsiveness, a reduction in awareness of surroundings, derealization, depersonalization, or dissociative amnesia, or if acute stress reaction signs and symptoms, which we will discuss later, do not diminish over time, usually about 30 days. There are many professional and peer support models and programs used to assist first responders and others suffering from acute stress reactions. Some are formal programs offered by healthcare organizations, some are put together by the respective organizations of the responders, and some are informal. All have their advantages and disadvantages. So what is an acute stress reaction? Why is a support model even required? Why are some people affected but others not? The first step in the EVVRe Care model is education. Everyone should be educated about stress, how to manage stress, and how to protect from or mitigate acute stress reactions which may occur after stressful events. You should be able to recognize stress reactions, know how to reduce stress and prepare yourself for acute stress reactions, understand that acute stress reactions are normal reactions to abnormal events, identify how to cope with stress, and realize when professional help may be required. As suggested earlier, stress is a response to a perceived threat or stressor that causes a physical or psychological response. The response is designed to protect or enhance life. It prepares the body to either run away from or fight the stressor. This is known as the fight or flight response. It helps you be creative and productive and make necessary changes in your life to manage or avoid the stress. It is a required driving force. Without stress, there would not be any change or growth, but at the same time, too much stress causes many medical problems. There must be a balance. We deal with stressors every day. Stress can cause many illnesses which can be addressed through stress-reducing activities and behaviors such as proper nutrition, sufficient exercise, and adequate sleep. Other suggested strategies can be of benefit such as avoidance of alcohol, caffeine, and unhealthy foods, or simply avoiding the stressors if possible, which may include drastic measures such as a change in vocation or even relationships. So what is being suggested is a holistic, rounded approach. Preventative strategies such as a healthy diet, positive recreational pursuits, social activities, physical activity, listening to music, reading, progressive relaxation, or relaxation alternatives such as deep breathing exercises, meditation, or prayer, all contribute to balancing the stress, but the most important thing is attitude. What you think and what you believe has a large effect on your mental health and your physical well-being. Remember, it is the perception of the individual which determines not only the existence of a stressor, but also the severity of the stressors. It is disparity between an experience, real or imagined, and personal expectations, beliefs, and resources to cope that can cause stress. To some, this may be known as a reality gap. For example, a person living within personally accepted expectations may have no stress even if the conditions might be interpreted as adverse for some outside perspective. Living in comparative poverty, yet unstressed because their resources meet their needs and expectations. Similarly, paramedics cope with situations on a daily basis that most normal people, from an outside perspective, could not cope with. But if there is a chronic disparity between experience and expectations, stress may increase or be relieved by adjustment of expectations to meet the ongoing experiences or conditions. An important fact is that if any one or more of the suggested preventative strategies are missing, the individual's ability to manage stress will diminish accordingly, meaning that as the number of missing strategies increase, the individual's ability to manage stress will decrease. This can be compared to physical illness. If you are run down and your defenses are weak, you'll be more prone to illness. The same can be said for stress. If you're not healthy physically, emotionally, and spiritually, you will not be able to manage your stress effectively. The question, what is an acute stress reaction, was posed earlier. An acute stress reaction is a group of reactions to an incident or event. It may be a major stress event experienced by the person, also known as a critical incident, such as being a witness to or experiencing tragedy, death, serious injuries, or threatening situations. Or the incident need not be a dramatic one, but will most likely have some sort of significance for the person experiencing it. Again, as a reminder, it's the perception of the individual that determines the existence of a stressor. It may have made the person question an aspect of their beliefs, values, attitude, or behavior. So the immediate reactions to a critical incident could include nausea, muscle tremors, sweating, dizziness, chills, increased heart rate, increased blood pressure, hyperventilation, confusion, difficulty making decisions, impaired thinking, difficulty problem solving, memory loss, anomia, which is difficulty remembering the names of things, anxiety, anger, or fear. One important item to note is that just because an individual experienced a critical incident, it does not mean that they have been traumatized. Although it may strain their immediate ability to function in a normal capacity, these reactions are normal immediate reactions to abnormal events. It hurts, and then the pain goes away. It is considered a trauma only if there are lasting adverse effects on the individual's functioning and physical, social, emotional, or spiritual well-being. Some people are unaffected, and for others, reactions may differ and be severe enough to interfere with a person's ability to function during or after the event. These immediate effects may develop into further physical, cognitive, and emotional signs and symptoms, which may also cause certain behaviors. So some physical signs are sleep disturbances, such as insomnia or hypersomnia, night sweats, fatigue, excessive sweating under stress, nausea, muscle tremors, startle responses, and sexual dysfunction. Some cognitive signs may be forgetfulness, inability to concentrate, unable to accept criticism, defensive, loss of humor, loss of trust, daydreaming, decreased attention span, memory problems, flashbacks, and nightmares. Some emotional signs may be grief, depression, guilt, self-doubt, anger, which is linked with frustration and disappointment, anxiety, hopelessness, and can even progress to suicide tendencies. So these signs and symptoms will be exhibited in behaviors such as withdrawal or isolation, change in appetite, increased alcohol use, inability to rest, pacing, change in social activity, change in speech patterns, change in communication, and antisocial acts. It is the number, intensity, and duration of signs and symptoms present, or the intensity of the change in behaviors, that indicates the severity of reaction and the potentiality of trauma. The severity of the reactions depends on several factors. Factors related to the incident, such as the suddenness, intensity, or duration of the stressor or event, or factors related to the person, such as the individual's personal loss, current level of stress, the cumulative factor, past experience, physical health, emotional health, personal belief systems, support systems, and personal coping abilities. Clearly, the healthier the person is as a whole, the less severe the reaction. Being healthy physically, emotionally, and spiritually mitigates trauma and the potential onset of mental illness. A less resilient person may experience a more severe reaction, which may lead to acute stress disorder, ASD, or post-traumatic stress disorder, PTSD. So why, if signs and symptoms and behaviors are present, is it not always considered trauma? First, as previously suggested, the intensity of the reactions could indicate trauma, but for most, it seems that a certain amount of time is necessary, 30 days according to the book, for an individual to process the psychological impact of exposure to a major stress event, and no external stimulus or program may be capable of shortening this interval. The person's thoughts and feelings need to be processed. A cognitive reorganization of sorts. Belief paradigms may have been affected, values may have been challenged. It is when the thoughts and feelings cannot be reconciled with personal belief paradigms and values, and thought processes can't be changed when PTSD ensues. Common methods for dealing with acute stress reactions usually include a form of diffusing. Diffusing is psychological first aid and occurs within a few hours of an incident. It usually concentrates on individuals and is usually managed by peer support personnel. The literal definition of diffuse is to make less dangerous, tense, or hostile, and diffusing is the act of deactivating or making ineffective. The error in this description is the assumption that diffusing is offered by trained personnel. Anyone can perform a diffusing. It is human nature to diffuse ourselves after experiencing a critical event, although some of us are better at it than others. It is through talking about the event and how it made you feel, something women seem to be better at than men, that is the next step of the EVVRe Care model. Ventilate. Vent to peers, friends, and family. To talk about the event or events. Talk about the sights, the sounds, smells experienced, actions of you or others, your feelings, your reactions. But this is only one half. What is ventilated must be validated. So you need to understand for yourself, or if you're dealing with a peer, to inform the individual that the event was abnormal, but given the circumstances, the signs and symptoms being experienced are normal, feelings are normal, and the outcome of the event was not a result and could not be changed by your actions or your peers' actions. Ventilation may be difficult for some. First responders often find comfort with other responders, but to no avail believe that their families and friends in other professions are unable to completely understand their experiences. This is a weakness because responders also hide their emotions to keep the appearance of strength in front of their peers. A display of emotions does not equate with weakness, and as we will discuss next, an understanding of the specifics of an experience is not required to validate their thoughts and feelings. Validation can be equally difficult as most do not know how to respond. A few communication hints that can be quite helpful for peers who are assisting an individual through the ventilation process are active listening, where the listener paraphrases what they heard and repeats it back to the speaker, not shifting attention to yourself with what may seem to be empathetic experiences, not saying things like, "Don't cry," but encourage them with affirmation that the emotions are normal. Social constructs have been created to encourage the ventilation process, such as funerals and wakes, where the grieving are able to connect and talk about the deceased, to ventilate their feelings if they wish to do so. Another form that encourages ventilation and validation, especially when the incident involved groups of people, is a debriefing. Debriefing refers to controversial sessions that revolve around the sharing and examining of information after a specific event has taken place and has been used for military, psychological, organizational, and academic purposes. It has erroneously been used as a proactive mental health intervention. According to the World Health Organization, formal interventions should not be delivered following potential traumatic events unless individuals develop a diagnosable condition. Debriefing was designed to provide a structure for open and constructive communication or to treat social psychological problems of an organization, not to mitigate a psychological disorder. This is not to say that an operational debriefing, where groups talk about the event and discuss potential system changes to avoid future incidents or how to better manage such incidents, should not occur, as just like funerals provide a forum to ventilate, this type of meeting too can create a social environment where peer-to-peer ventilation and validation can occur in an informal manner. The final two steps of the EVVRe Care model are re-evaluate and care. As a peer, maintaining contact, listening and monitoring signs and symptoms, and knowing when professional help is required is important. As an individual, the importance is on self-evaluation. So re-evaluate is to self-evaluate or follow up contact with the individual, monitor signs and symptoms to ensure they are diminishing over time, and seek professional help if required. Don't hesitate to ask the hard questions like, how are you feeling? Are you still thinking about the event? Are you sleeping? Are you eating? Are you engaging in negative coping strategies? And when we talk about negative coping strategies, we're talking about seclusion, drug or alcohol abuse, gambling, binge shopping, meaning excessive or out of the norm, or even promiscuity. Some other advice for peers is to spend time with the affected person. Offer your assistance with routine tasks, even like cleaning, cooking, caring for the family, just to allow them some private time. Try not to take their anger or other feelings personally. In the step of care, the focus is on healthy living, avoidance of negative coping strategies, and employing the positive coping strategies. So it includes understanding that the signs and symptoms being experienced or potentially could experience are a normal response to the abnormal event. As previously, follow the acronym STRESS and practice positive coping strategies while avoiding the negative coping strategies. Examples of positive coping strategies are task-focused behavior, such as gardening and hobbies, peer support, talking and expressing feelings, exercise, walking, jogging, aerobics, weightlifting, relaxation, such as yoga, stretching, humor, prayer and meditation, music, art, writing, regular routine, such as sleep-wake cycles, daily activities, and good diet. Include healthy foods, avoid sugars and caffeine. There should be an improvement noticed over time, usually about 2 weeks. If not, there could be a concern for trauma. Has the individual truly gone through the ventilation or validation process? Is the person practicing positive coping strategies? If the answer is yes, formal intervention should be considered. If the signs and symptoms have not diminished after 4 weeks, formal intervention should strongly be suggested. In conclusion, people deal with stress every day. Stress is a motivator and driving source, but too much stress can have negative consequences. A holistic, rounded approach can create balance and mitigate adverse reactions. It also prepares us for major stress events and minimizes the potential after effects. Just because a person has experienced a major stress event doesn't mean they have been traumatized. Professional interventions and formal programs for some can actually have a detrimental effect, and for most are not required unless signs and symptoms do not diminish over time, usually about 30 days. The number, intensity, and duration of signs and symptoms present, or the intensity of change of behaviors, indicates the severity of reaction and the potentiality of trauma. But through following all the steps listed in the EVVRe Care model, the lingering after effects resulting from the stress event, and even the potential onset of mental illness or PTSD can be mitigated. So remember, the steps are education, to educate about stress, acute stress, and how to mitigate stress, ventilate, to talk about the stress event and the feelings it has caused, validate, reassure that the feelings and the signs and symptoms being experienced are normal, reevaluate, make follow-up contact and monitor signs and symptoms for improvement and awareness of when professional help may be needed, and care, put into practice positive coping strategies while avoiding negative coping strategies. I hope you find the EVVRe Care model helpful in your day-to-day struggles. Please check out my YouTube channel to hear my personal story. In the meantime, I'd like to leave with you 2 questions to reflect on. What can you do to help yourself, and what can you do to help each other?